Hey everyone, and welcome back for another deep dive. Today we're going to be tackling a company that's really interesting. It's a company that's leading its industry, but also facing some pretty tough times financially. It's kind of a head scratcher, and well, the company is Teladoc Health. The big name in virtual care.
Yeah, Teladoc's a really fascinating case study. On one hand, they're at the top of the telehealth world, no question. But then their recent financial reports have left some investors wondering if they can really, make money in the long run.
Exactly. It's like this strange contrast between being the leader and then struggling to turn a profit. So today we're going to really unpack all of that. We'll take a close look at how they've been performing, what strategic moves they've made, and most importantly, we'll try to see if those actions are setting them up for a successful future. You ready to dive in?
Absolutely, let's do it.
All right, so let's start with a quick snapshot of their recent financials. In the third quarter of 2024, Teladoc brought in $641 million in revenue, which is a lot of money, but it's actually down 3% compared to the same time last year.
Right, and, on the surface, that decline might seem a little alarming. It's not quite as straightforward as it looks. Teladoc actually has two main parts to their business, integrated care and BetterHelp. And although their overall picture is mixed, those two segments are telling two very different stories.
Oh, I like when things get a little more granular, so tell me more about that.
Sure, so their integrated care segment, which by the way focuses on providing those virtual care services through employers and health plans, well, that segment actually saw a 2% increase in revenue. And they even improved their adjusted EBITDA margin, which basically means they're squeezing more profit out of each dollar of revenue.
Okay, so one segment is holding strong. What about BetterHelp? The mental health platform they acquired a while back. Wasn't that supposed to be a big growth driver for them?
It was, and it definitely still has a lot of potential, but it's facing some challenges right now. BetterHelp saw a 10% drop in revenue, and on top of that, their adjusted EBITDA margin is shrinking. So yeah, it's pretty clear that Teladoc needs to turn things around in that segment if they want to reach that sustained profitability.
Yeah, it's like a seesaw. One side is up, the other is down. But they haven't just been sitting around watching the numbers. They've been making strategic moves, including buying a company called Catapult Health for $65 million. Now, this wasn't just a random purchase, was it?
No, not at all. Catapult Health is all about preventative care, which is a super important part of healthcare but often gets overlooked. They're specialists in virtual preventative care services, offering things like at-home diagnostic testing and creating personalized health plans.
So instead of just treating you when you're sick, they're trying to stop you from getting sick in the first place. It sounds like a pretty smart move, especially with chronic conditions being such a big driver of healthcare costs.
Exactly. And think about how this acquisition fits into Teladoc's overall strategy. They want to be that one-stop shop for everything virtual care. So let's say you get an email from your employer saying it's time for your annual wellness check, and they're partnering with Teladoc to make it easy.
Okay, I'm following you.
All right, so using Catapult Health, Teladoc can now send you a home testing kit to check your cholesterol, blood sugar, and other important things. You just do the test at home, send it back, and then a healthcare professional goes over the results with you virtually. And maybe they'll recommend some lifestyle changes, or if you need it, they'll connect you with a specialist within Teladoc.
So it's all there right on the Teladoc platform. Pretty smooth.
It is, and it shows that Teladoc is thinking beyond just treating you when you're sick. They're looking at the whole picture, from preventing illness to diagnosing it to treating it and managing chronic conditions.
All right, so they're definitely stepping up their game when it comes to preventative care. But they're also going all in on something that everyone's talking about these days, artificial intelligence.
Yeah, and for good reason. Teladoc sees AI as a way to make their platform even better, more efficient, and more personalized. And they're not just throwing AI at every problem, they're focusing on areas where it can really make a difference. Things like patient safety and making things easier for healthcare providers by cutting down on paperwork.
Now, you mentioned virtual sitter earlier. I got to hear more about that. It sounds like something right out of a sci-fi movie.
It's a really clever use of AI. So imagine you have a patient in the hospital who's at risk of falling. In a perfect world, a nurse would watch them constantly, but, staffing shortages are a real problem. So Teladoc has developed this system that uses cameras and sensors to monitor patients remotely. It can even detect little movements that might mean they're about to fall.
So it's like having a digital guardian angel looking out for these patients.
Exactly. And the best part is that one person can now watch over many more patients at the same time. We're talking maybe a 25% increase in capacity. So it improves safety and it frees up nurses to focus on other things.
Wow, that's impressive. But they're not just using AI to keep an eye on patients. They're also tackling that mountain of paperwork that doctors hate so much. They're calling it ambient clinical documentation.
Yeah, which is a fancy way of saying they're using AI to automate all that tedious documentation that comes with seeing patients. They've partnered with Microsoft to use tools like Nuance Dragon Ambient Experience or DAX for voice recognition, and they're even using OpenAI's GPT-4, which is a really powerful language model.
Wait, GPT-4, isn't that the thing that can write poems and build websites? What's it doing in the doctor's office?
Yeah, it's pretty crazy, right? But it's actually a game changer for clinical documentation. During a virtual visit, these AI tools can listen in on a conversation between the doctor and the patient, and then they transcribe it and summarize the key points into those clinical notes.
So no more doctors working late just to catch up on paperwork.
That's the idea. It frees up their time so they can spend it with their patients. And it goes beyond just saving time. By reducing that administrative burden, it can help with physician burnout.
All right, so I'm starting to see how all these pieces fit together. They're creating a more complete and integrated virtual care platform. And AI is a big part of making that happen. But they've also been busy forming partnerships, right? Like that collaboration with Amazon.
That's right. Amazon seems to be teaming up with everyone these days. But their partnership with Teladoc is really interesting. It's focused on connecting people with Teladoc's programs for managing chronic conditions. They do this through Amazon's Health Benefits Connector.
So how does that work? Is Amazon going to start recommending Teladoc right next to those blood pressure monitors and fitness trackers?
Pretty much, let's say you're on Amazon looking for a new blood glucose meter because you have diabetes. If your health plan covers Teladoc's chronic condition program, Amazon might show you a message saying, hey, did you know you have access to this great program that can help you manage your diabetes better?
And that's huge because, navigating health insurance benefits is confusing for a lot of people. They might not even know what programs they have access to.
Exactly. This partnership could really help people get enrolled in programs that can improve their health. It's a win for Teladoc, a win for Amazon, and most importantly, a win for the patients.
Okay, so we've got acquisitions, AI integration, strategic partnerships. Teladoc is definitely not slowing down. But the big question is, are all these moves enough to put them on the path to making money consistently?
That's the million-dollar question, and that's what we'll dig into next.
All right, so we've seen that Teladoc's making some bold moves, but no company's journey is perfectly smooth. What are some of the challenges they're facing as they try to reach that goal of profitability?
Well, one of the biggest challenges is how their BetterHelp segment is performing. We already talked about the revenue going down and their margins shrinking, but the problem goes deeper than that.
Okay, so what's at the heart of the issue?
Well, a big part of it is just how competitive the market has become. When Teladoc bought BetterHelp, it was really the first in that direct-to-consumer mental health space. But now there are tons of apps and platforms all trying to get a piece of that market.
Yeah, it's like that saying, imitation is the sincerest form of flattery, except in this case, it's also hurting their profits.
Exactly. And to make things even tougher, the cost of getting new users has gone way up. Everyone in the digital health world is fighting for attention, and that means advertising costs are eating into everyone's bottom line.
It's like a virtual arms race, but instead of weapons, they're fighting with marketing budgets. So how is Teladoc planning to deal with this? It's a crowded and expensive market.
They're approaching it from different angles. First, they're focusing on being more efficient operationally. Remember all those changes CEO Chuck DeVita announced last year? They're streamlining processes, getting rid of things they don't need, and generally trying to do more with less.
So tightening their belts a little. But they're also exploring ways to bring in more revenue, right? Like integrating BetterHelp with insurance plans.
Exactly. Right now, BetterHelp is mainly a cash pay service, which limits how many people can use it. If they can make it easier for people to use their insurance to pay for mental health services through BetterHelp, they could open up a much bigger market.
That sounds like a smart move, but I imagine working with insurance companies is not easy.
You're telling me it's a complicated process that involves building the right systems and working with the right partners. But if Teladoc can do it, it would be a huge change for BetterHelp and for the whole virtual mental health industry.
And speaking of partnerships, let's go back to that Amazon collaboration. It's more than just a marketing campaign, isn't it?
Absolutely. It's a strategic move that could help Teladoc reach a lot more people. Think about it. Amazon has millions of customers, and a lot of them are already using their platform to manage their health and wellness. By working with Amazon's Health Benefits Connector, Teladoc can tap into that and connect people with the services they need.
It's like meeting people where they already are instead of trying to pull them to a new platform. It makes sense. Okay, so we've got efficiency measures, insurance integration, and strategic partnerships. What other moves are they making to try and reach profitability?
Well, they're also focused on expanding internationally. Teladoc's already in several countries outside the U.S., but they see a huge opportunity to grow even more globally.
Like exporting the virtual care revolution. It makes sense because people everywhere need accessible and affordable healthcare.
Exactly, and we're already seeing some good results from their international efforts. Their revenue from outside the U.S. grew by 15% compared to last year. Now, that's still a small part of their total revenue, but it's a segment with a lot of potential for growth.
So international expansion is one piece of the puzzle. But let's talk more about their investment in artificial intelligence. It's more than just about using cool technology. There's a strategic reason behind it, right?
Definitely. Teladoc sees AI as something that sets them apart from the competition, a way to build a really unique and valuable platform. And they're not just applying AI randomly, they're focusing on areas where it can have the most impact.
Like we talked about earlier, patient safety with a virtual sitter and reducing administrative burdens with ambient clinical documentation. It's like they're strategically using AI to solve some of the biggest problems in healthcare.
Exactly. And that's just the beginning. There are so many possibilities for AI in healthcare. Imagine AI analyzing your medical history and your genes to tell you if you're at risk for certain diseases.
That would take preventative care to a whole new level.
It would. Or imagine AI-powered virtual assistants that could help patients understand the healthcare system better. Things like scheduling appointments, managing medications, and even giving emotional support.
It's like AI could be the ultimate healthcare companion, guiding us through every step of our health journey.
Exactly. And Teladoc seems to be determined to be a leader in making this happen. They're investing a lot in AI research and development, and they're partnering with big tech companies like Microsoft to make these innovations real.
Okay, so they're streamlining operations, expanding globally, and betting big on AI. They're building a solid foundation for future growth. But let's get back to the bottom line. When will we actually start seeing profits?
Well, they're projecting an adjusted EBITDA margin. Remember, that's how we measure their operational profitability. They're projecting that to be between 14.9% and 15.3% for all of 2024. And for the fourth quarter, they're estimating a margin between 12.25% and 13.75%.
So they're still making money, but those margins have been getting a little smaller.
Yes, and that's partly because of those higher advertising costs we talked about. And it's also because they're investing upfront in things like AI and international expansion. It's a delicate balance. They need to invest in growth, but they also need to keep a close eye on their expenses.
It's a high-stakes game for sure, but at least they have plenty of cash on hand, right?
They do. They ended the third quarter with $1.24 billion in cash and cash equivalents, and they're planning to use some of that to pay off their convertible bond that comes due in June 2025. This strong financial position gives them some breathing room to keep investing in growth, even if it takes a bit longer for them to become consistently profitable.
So it's not a question of if they can make a profit, but when. And whether they can make all these ambitious plans work will determine if that happens sooner or later.
Exactly. There are still a lot of unknowns, but they've laid out a compelling vision for the future of virtual care, and they have the resources to make it happen. It's going to be interesting to see how it all plays out.
So we've gone through Teladoc's financials, we've looked at their strategies, and we've even talked about AI and healthcare. But I think the big question is, can they actually pull this off? Can they really become profitable and stay profitable?
It's the question everyone's asking, and to be honest, there's no easy answer. We've seen their revenue going down, their margins getting smaller, and there's a lot of competition in virtual care. It's definitely a challenging situation.
Yeah, it's enough to make anyone a little worried, but they are still the leader in virtual care. They have a huge number of users, a solid platform, and clear vision for the future.
And don't forget about all that cash they have. It gives them the flexibility to make moves, buy other companies, invest in technology. It's like a safety net while they figure things out.
Yeah, like a cushion for those high-wire acts, but they're not just sitting on that cash. They're actually doing things, right?
Absolutely. They're not just waiting around. They're tackling those problems with BetterHelp head-on. They're looking at integrating with insurance plans and expanding globally. These are not the actions of a company that's okay with things staying the same.
It's like they're playing chess on multiple levels, making strategic moves and adapting to how the healthcare industry is changing.
And one of their biggest moves is really embracing artificial intelligence. They're not just trying it out, they're making AI a core part of their platform. It's not just about being more efficient or automating tasks, it's about changing how healthcare is delivered.
It's about making healthcare easier to access, more personalized, and more proactive. It's about giving patients control over their health and giving providers better tools to care for them.
And that's where things get really interesting. We're just starting to see what's possible with AI in healthcare. Imagine AI predicting and preventing chronic diseases, personalizing treatment plans based on your genes, even providing companionship and support for those going through tough medical situations.
It sounds like the future, but it's probably closer than we think. And Teladoc is right there leading the way. Their investments in AI could put them in a really powerful position as healthcare changes.
Of course, there are risks. AI is still pretty new, and there are ethical and regulatory challenges, but the potential benefits are huge for both Teladoc and for healthcare in general.
So back to our big question, can Teladoc actually become and stay profitable?
It's tough to say for sure, but they have a good foundation. They have the resources, the vision, and they're willing to adapt. If they can handle these challenges, well, execute their strategies and use the power of AI. I think Teladoc has a real shot at not just becoming profitable, but shaping the future of healthcare.
And that's a future worth investing in. So there you have it, our deep dive into the world of Teladoc. We talked about their past, analyzed their present, and even got a glimpse of what their future might hold. Now it's your turn. What do you think? Do you believe Teladoc's on the right path? Are they making the right moves? Is this a company you would invest in? We've given you the information. Now it's up to you to decide.
Remember, knowledge is power, and hopefully this deep dive has given you some insights to help you make smart decisions. Decisions about your own health and your investments. Keep exploring, keep learning, and keep diving deep.